Hi, my name is Dr. Clark Gaither. I'm a family physician, author, speaker, consultant, and personal coach. I want to talk to you about a topic I'm very passionate about: job-related burnout. I became interested in job-related burnout because I became burned out in my chosen profession as a family physician. It wasn't something I wanted to happen. It wasn't something I thought could happen. It didn't happen overnight, and I didn't recognize it for what it was at first. All I knew was I was miserable. The onset was insidious. I began to feel more and more time pressured at work. The demands of my job began to seem too unclear, unreasonable, chaotic, and high-pressured. Work no longer seemed as challenging. Making myself go to work seemed like the bigger challenge. An overwhelming sense of dread associated with going to work began to creep in, along with a sense of relief when the weekend finally arrived. I began to develop an uncomfortable feeling I had to be too many things for far too many people. There was a general sense no time could be taken off from work without negative consequences. I had trouble concentrating. I felt as though I had no help. I became less patient, less empathetic, less enthusiastic, and more irritable, intolerant, exhausted, and cynical. I began to disengage from patients, friends, and family. I became unmotivated, uninterested, and uninteresting. I no longer felt recognized or rewarded for good hard work. Eventually, I felt as though I had nothing left to give. Clearly, this was not what I signed up for when I chose medicine as a career. Believe me, if you would begin to experience those feelings in your chosen profession, you will also feel as though you are no longer making a difference. You will begin to question everything: your profession, relationships, interests, and activities. You'll feel you do not fit in them, or they do not fit in you. That maybe you should be doing something else with your life because you have nothing left to give to the life you have. Tragically, some severely burned out individuals begin to feel as though life is no longer worth living. In my profession, suicide is 6 times higher than in the general population. Continuously questioning yourself, is this all there is to life? Is there nothing more? That could be a sign you are burned out at your job, a relationship, or on life and living. You know, it just doesn't have to be that way. The thing is, people who are burned out rarely recognize their symptoms as burnout. They may incorrectly ascribe their feelings to ambivalence, anxiety, stress, depression, sadness, or just increased irritability. Although burnout can lead to all of those mood changes, they are not the underlying cause. They are just symptoms. Those who know someone who is burning out or burned out may be left to wonder, is the change in their behavior due to stress, depression, drug use, relationship problems, money problems, a personality disorder, or character defects? Again, work-related burnout is not usually suspected as the cause. The key to recognizing burnout is to become familiar with these symptoms and to know and understand the principal hallmarks of burnout. To download a free 21 Symptoms of Burnout checklist, go to my website at clarkgaither.com or click on the link directly below this video. In the next video series, I will be defining for you the 3 principal hallmarks of job-related burnout. And thanks for watching.